We Infuse Podcast, episode number 76. Welcome to the We Infuse Podcast. My name is Amanda Brummett. In every episode, we give you a seat at the table as we talk to infusion center owners, operators, and experts so that you can get the insight you need to run a thriving practice. In this episode, we talk with Aaron Smith, Chief Executive Officer of Vetriq. He shares how Vetriq delivers a unified platform for payer and patient workflows using automation, real-time analytics, and intelligence to create predictable, efficient, and fully visible financial operations. Well, Aaron, thank you so much for being here. We are so excited to have you on the show. You have such a rich background in infusion. Can you start by just telling us who you are? Give us all the details on your background and how you found yourself in infusion.
Sure. And thank you, Amanda, for the opportunity to talk to you and your listeners about Vetriq, about infusion, and everything that we're going to chat about today. I've been in healthcare for about 25 years. Most of that time, I've been fortunate enough to be building companies. The first one was a software company that I sold to Healthways in about 2013. The more recent one was FlexCare, which I think many of your listeners have probably heard of.
I think all of our listeners. You're being humble.
Well, that I founded with Callie Turk, and which, if everybody knows FlexCare, everybody knows Callie as well. And so we founded FlexCare in 2019 and recently sold that to Optum.
Before we get into everything we actually came to talk about today, can you give us the FlexCare origin story?
Sure. I had the family member with Crohn's, and the beginning to understand the challenges that many patients face during the intake process, and it's hard enough being a patient, but nobody gets referred for an infusion whenever it's not that bad, right?
Right.
There was a pretty challenging situation going on whenever she was referred, and so the timing was extraordinarily poor. The timing to run into these challenges, going through multiple providers, trying to figure out how to get it approved and get her in there, it was eye-opening to me, the state that the industry was in. And I actually worked for Optum Infusion at the time, so I had a bird's eye view into all the challenges that were in there and the barriers to that first patient access. It was also a wonderful place to figure out how it could be done better, because I had lots of very smart people to talk to.
Sure.
One of which was Callie Turk. That's how we met, and how we decided at that point that was a real opportunity. If we could, clinical care is not the problem in the infusion industry. It is the complexity at the back office that is the problem. And
Sure.
with my technology background and her lean towards process and deep expertise in the operational area, we thought, hey, this is a problem that we can solve. And so we decided to solve it, figured out where we were going to open up. I had figured out our first clinic, which was going to be in Oklahoma City. But then we ran into our next problem, was Optum Infusion was home infusion, which is an entirely different monster from AIC.
Sure.
And that is, incidentally, how we, in going in, looking around at the different options for a platform, we also worked with Reese to figure out how to build, not just get our technology, but build the platform itself, build the clinic, figure out all the processes. Man, the amount of help that he gave us, experts in each one of the different industries to get us started. So we are longtime friends of We Infuse, and our existence and the opportunity for the growth that came along, largely due to Reese holding our hand, and for months on end, it seemed like. I know he must have gotten tired of us, but holding our hands to get us started.
Oh,
But
that's incredible.
it also made us appreciate the ability to work with people who understood the industry inside and out, and a good platform, just an incredible platform to build the operation on and around. It was really it was a fortuitous meeting for us to be able to work with the WeInfuse folks from day one.
Nice. And did you know back then that you would eventually, hopefully one day, sell that to Optum and make it full circle?
It's interesting. We did know that we would at some point sell. The to wind up selling to the ones who we left
Yeah.
was a bit of a was a bit of a surprise, but it also made things easier because Callie was and is a hero among that team. So whenever they showed up knocking on our door, we automatically had an awful lot of credibility from the work that she had done in the multiple years prior with them.
Yeah. Healthcare's a small world and it's all about those relationships.
It is healthcare itself is a small world, and the infusion industry seems like it's about 12 people, except
Yes.
it's not, it's thousands, but somehow we all know each other. It's incredibly small.
Yeah. And then, Aaron, do I recall properly that you were on the board for the Crohn's and Colitis Foundation, did some volunteer work there as well?
I just recently left the board, but was on there for 2 years, and maybe more importantly, or more, it was certainly more fun, was the opportunity to work in Oklahoma City on reestablishing the Take Steps fundraiser, which was pretty small. Crohn's disease. It's a incredibly challenging disease, and that it doesn't get a lot of investment. It doesn't get a lot of publicity, and those who have it, yeah, it's challenging for them to talk about it outside of their social group or other people who have it
Yeah.
with some sense of shame. And that's the part that just kills me is diseases that include shame they're heartbreaking to me.
Oh, yeah.
It's it's also the tie-in to the infusion centers is that it is a disease that is getting more and more controllable by some of the biologics that are out there. They is just outstanding now. So anyway, working with them for 6 years was absolutely a light for me. It was very fun, very enlightening, very fulfilling. They're a great organization.
Yeah. Well, thanks for taking the time to carve out and do that in the midst of a very busy period in your life.
You get your happiness from all the side gigs that you're doing.
Yeah,
Actually, I try to get my happiness wherever I can get it, but that certainly was one of them.
definitely. Thanks for indulging me in that quick detour. Now tell us what you're doing now.
Currently, I have a new venture going, which is Vetriq, and we're focused on what I like to think of as the last mile of a revenue cycle, which is the indexing of the correspondence and the reconciliation of the data that goes into Lockbox.
Aaron, it feels like you took all your areas of specialty, infusion, RCM, AI, tech, and put them together to build this. Would you say you have a certain specialty in that realm, or are you more a jack of all trades?
I think a jack of all trades is probably pretty close, but I really I take I bring technology in to work with people. I use technology to help people work and have flow. And because what I've learned over the years, with the initial one was my initial company was software platform, practice management platform. But there are so many good practice management platforms out there these days. That's not really where I have wanted to go or what I've wanted to do. But in FlexCare, Optum, prior, now with Vetriq, the the opportunity that is out there in spades is that we've got all these single platforms that are out there, but they leave gaps. They leave edges that are unfilled, and that's where things break down.
Sure.
That's where the data breaks down, the flow breaks down, it loses time, it leads to errors. And if you can figure out how to fill those gaps, both with technology and by simplifying the processes
Yeah.
within those gaps, then it allows companies to. It's shocking how much more efficient you can make teams and people teams and companies whenever you can plug those gaps with a good technical solution that fits a very simplified workflow. So anyway, that's going back to my expertise, if I have one as a jack of all trades, is really a focus to identify where are the gaps that we are breaking down, where are the bottlenecks, and how can we fix those to improve quality, improve efficiency, or sometimes just simply to make work better for those people who are doing it.
Definitely. I suddenly realize exactly why you partner with WeInfuse. It sounds like you're very compatible.
That is absolutely the truth, and they are really the prime example of technology. These platforms out there can create such efficiency, and you really build your system around them. You build your system around them into places, but they cannot. They have to draw the line at what functionality they are producing and providing. And lockboxes are one of those things, right? Their business is not the business of providing transparency into what's going on into the lockbox, or reconciliation
Hmm.
for 10% of the checks in there, or all that. But those are real problems. And
Oh, yeah.
in infusion especially, little small misses turn into huge problems because the drugs are so costly and the margin is so small. So anyway, WeInfuse is a perfect example of what I like to do, which is represented here by Vetriq, which is there's a gap that technology can fill. And whenever technology fills it, it improves the quality, improves efficiency. Really, it makes everything better.
Yeah, most definitely. So go ahead and lead us down the path. How did Vetriq form and what exactly does it do for infusion providers? How does it make that lockbox not the black box?
I, I kind of like that. That was make put you on making the black box, not the black box.
I've run a practice. As soon as you said lockbox, I said, oh gosh, there's no transparency there.
It is so descriptive and such a pain in the rear to have to go and grab the files out and drag them from one place to the other and wonder if you copied them, right? All that stuff.
Yep.
Well, it was the goes back to my understanding of the problem. Actually, let's start with just the problem. The
Sure.
largest problem within infusion and within healthcare is revenue cycle. It's getting paid consistently,
Hmm.
time and and dependably in a way that you can measure and use. And it is so incredibly challenging. And again, it's not typically because of the revenue cycle platforms. Again, WeInfuse has a fantastic revenue cycle platform. But it's whenever you have something that falls in a gap, falls in a crevice, and a perfect example is communication.
Mm.
If you get a denial, but that denial comes across as a fax, and it goes into somebody's inbox who happens to be on vacation, or if it goes to the provider rather than to the infusion provider, or if it goes into a lockbox and it is picked up by somebody who is on the revenue cycle team, not on the intake team, and it doesn't get discovered, it's going to have serious consequences. That lack of visibility leads to,
especially if Mrs. Smith has an appointment tomorrow.
Absolutely, if Mrs. Smith has an appointment tomorrow, or if if she has already had her appointment a week ago and she has one coming up next week, and you have just received a notice that says you're not going to be paid the $20,000 for the Crystexia that they were infused with last week, and you go
Ouch.
ahead and infuse them again, now you've doubled up. You've
Yeah.
doubled up on your mistake. That transparency, and again, I just keep going back to small problems in infusion just create outsized bad outcomes, outside bad experience.
Exponential.
And so so anyway, understanding how little margin we had to work with was part of that, and understanding and going through identifying the gaps in the revenue cycle process so that we could improve it, become as efficient at collections as possible. I discovered relatively recently, it was about a year ago, that we had 6 people managing the 6 people managing our 6 lockboxes. And I thought that seems like a 10% of 10% of our patients and encounters, 10% of our correspondence actually go through the lockbox. And it seemed like a lot of people. Now, they weren't full-time doing this, which may have been part of the problem, but if there were 6 people, they're in a tough job where they have 15 different things to do that they are responsible for doing. And these lockboxes are sort of an afterthought as far as having to manage them. They are not their primary job. And so you have this many people, it's not their primary job. It can lead to problems, and in cases it did lead to problems, usually around transparency. And this is 10%, roughly 10% of our patients or 10% of our checks would come through there. Could be more. In many cases, for other people, it is more. But that's 10% in infusion dollars. 10% in infusion dollars, it's a lot of money going through something that is a complete black box. Understanding that, beginning to understand that problem was the start of it. And then the technology has changed so much over the last couple of years, and the ability to go in and address problems with technology, not only with analytics and identifying problems, but with automation, which is vastly more important, because now if we can identify the problem, we can go ahead and we can have technology go in and automate it.
Mm-hmm.
And whether they automate 50%, and then you have humans in the loop, you've still removed 50% of the 50% of the work.
Right.
But this is a case where we can remove 100%. We can address all the problem. So Vetriq came about with the understanding that there's a pretty simple and boring problem, which is more important than anybody ever really thinks about, that is completely and totally fixable. And so anyway, that's the reason that we've decided to go into it and address this problem. We don't plan on stopping with the lockbox. There's an entire chain through the revenue cycle, piece of different items that we can identify and address. But that one area that ties together the banking system, the practice management system, the revenue cycle system, and making sure that everything is tightly aligned, it's a terrific opportunity to step in and make a difference out there with all of our peers.
Yeah, definitely. It seems like you're solving a problem that is just an inconvenience for people, but a very expensive inconvenience, and nobody wants to do it.
That's just it. Nobody wants to do it. Nobody wants to do it in a team which has outsized turnover anyway.
Mhm.
None of them love so many pieces of that job are challenging, and sitting there, going and pulling documents from one place to another, and then retyping the information out of that PDF document into your one or two systems that you need to do. It's not fun for anybody.
No, most definitely. And then I assume that this is all connected with the WeInfuse platform.
It is. I, we are, We Infuse is what I believe their newest partnership. And so what we will do is we will, for all of the paper checks that come in, that come in and hit the lockbox, we will we will identify the paper checks. We will go through, process the EOBs, use that to create a document that then becomes postable inside of the revenue cycle system. So that way your paper checks that come into the Dropbox and your EOBs that go in there to explain the benefits of what you've received, that data then is integrated in, it gets read in from the lockbox and goes into WeInfuse, where all of your data, including your paper checks, can be reconciled.
Nice. So you're truly a bridge between their treasury management system and their practice management system.
Yes,
Do you work
exactly.
with all of them? Every
We do.
EHR, every bank?
Yep,
Nice.
we do. Some of them are more manual than others, but yes, we are completely independent so that we can take the files and work with anybody, so that we can tie the systems together.
Yeah. So you basically picked the two hardest industries to integrate and said, we can do it.
Yeah, we're
Finance and
gonna
health. We've got it.
yeah, they both certainly have their complexities, and they also are a little bit resistant to innovation. So it's a fun corner to work in. But that also means they've scared a lot of the competitors away. So I'm showing up to help.
Fantastic. And then either staying in this same topic or with your broad experience, feel free to take it outside of that. What would you say the biggest challenges that you see infusion center owners encounter?
I The one that I mentioned earlier, which is
Yeah.
getting paid, right? It's getting there are so many different ways that you can be tripped up
Hmm.
within the revenue cycle process, whether it's through underpayments to the payers, overpayments that you didn't recognize at the time that then get clawed back, putting you into a financial difficulty,
Yep.
or denials, as we discussed, denials that don't get detected, denials that do get detected, but are challenging to overcome. Revenue cycle really is the most challenging part of our business, because it doesn't take, given our given our margin, the smaller margin levels, it doesn't take very many problems before it then puts before it can unexpectedly put your clinics out of business, right? It is probably the most serious issue we have in there. And it is run it is run by teams that tend to it has a lot of different technologies in place, many of them not working together,
Yeah.
uh, creating a lot of the gaps that we see. So these teams do tend to do a lot of they have a lot of spreadsheets that they're living off of. And anytime you're moving your data out of a system into a spreadsheet, it tends
Not
to get
good.
old, tends to get bad, things tend to get forgotten.
Yes.
So it's an area that it is the biggest problem in healthcare. I
Yeah,
I believe completely, but certainly in the infusion area.
sure. And then with all your years of experience, what are some of your tips for navigating around that?
Automation where possible, right?
Yeah.
It's if you have and especially with the tools that are available
Mhm.
now.
Mhm.
They the tools and the partners, Vetriq being one, but we're not the only one out there that will help automate the different pieces down through. Again, the technologies out there are complete they are a world apart from what they were 2 years ago and 3 years ago, and it is the problems tend to occur not in your complex decisions or your complex discussions that you're having. The problems tend to occur where you're doing a lot of manual work over and over and over again, and where problems can pop up and you not necessarily find out. So you keep repeating the same problem really often. The the more of those problems that you can identify and automate, the better off you are as far as being able to improve the quality, improve the speed, the throughput of addressing that, which again goes towards scale. And even even whenever you put in the automation, if it's human in the loop automation, it still it still is a huge step forward because now you have people working a few exceptions rather than a large number of just redundant work where problems creep in.
Definitely. And then I assume you've had a lot of light bulb moments in your career, but if you can pick one or two specifically related to infusion that you could share, what are they?
The one that I've had recently
Oh,
it
yeah.
that the is that some of the problems that we've had in the infusion world
Mhm.
are exponentially more complicated in the MSO world, where they're
Mm.
doing infusion management for the physicians.
Mhm.
This was really interesting to me because tracking down money, we talked about the lockbox problem, and tracking down money,
Oh,
it was always something that was under our it was always something that was under our control. We controlled the people, we
yeah.
controlled the lockbox, we had pure visibility, but when you have MSOs that are working off of that potentially are working off of two different revenue cycle systems across
Yeah.
two different entities, that of the physician and that of the infusion organization that's working with the physician. But then you have payers who are sending the remittance advice or the ERAs potentially to the physician rather than to the when you have things going to entities that are not under your control, it creates a again a lack of transparency
Mm.
and and one that can be particularly sure challenging to figure out.
Yeah.
And the way that we were talking about lockboxes with one of our potential clients a about a month ago, and they were talking about how they had a denial that came through, but it got sent to the provider rather than to them. Yeah, rather than to the group that was to the infusion group. Whenever it came through, it was 20 days. It was about 20 days into it before they realized that it was denied. And fortunately, no other infusion had been done. They still had 10 or so days to get it overturned. They did get it overturned, but it was a close call. And evidently, things, things like that happen all the time. And I it just really struck me that out of all the challenges that we've experienced, that's one that I had never thought of.
Yeah.
That it that again leads to challenges in collections, but now has this political element of going across lines. And the really interesting thing was we in that particular case, they asking, "Did we get paid?" wasn't even the right or "Did we get paid?" wasn't even the right question. It was, "Do we know if we are going to get paid?" Like, they didn't even know to go and look for it because it just simply wasn't there. So it just in a world of complexities, they outdid the complexities that I know of, which I thought was both interesting and a powerful reason to figure out a solution for it.
Yeah. Which begs the question. I obviously Vetriq takes care of the infusion side. Can the
Right.
physician also be a Vetriq client?
Absolutely. And in that particular case, the allure is we can go in, provide visibility to everything that's going through.
Nice.
And then as as we go through and identify the information, we can then pull it out, send the appropriate information to both parties.
Hmm.
We're saving the physician from having to do the work, as well as saving the infusion providers from having to do the work as well. So, and this also comes up in cases where the EOB may come across and it may have medical services and the drug cost in there. We
Sure.
can we can pull apart the two. We can make sure that both parties know about it and we can get the information to both parties real time, not having to wait on whoever's in charge of actually managing that. So yes, we can. We can I pretty much anybody who has a lockbox, we can well, in the medical field, anybody who has one, we can bring some benefit.
Okay, fantastic. And then there's so much change and so much good stuff going on in the infusion industry right now. What are you most excited about?
Well, for obvious reasons, the technology, right? The technology and again, the automation part of it. Spent a lot of years. Both of the prior companies have had fairly heavy investment into analytics.
Mhm.
And it has been and analytics have been a little bit disheartening because
Hmm.
being able to see the issues, while that is half the battle, it's not the whole battle. You also have to put in place the processes to get things addressed. And again, whenever you're talking about these teams, whenever you're talking really about any of the back office teams, not just revenue cycle, although it certainly applies, identifying the problem doesn't necessarily relieve them of the work that they have in place. Most of these teams have they show up every day with more to do than what they can actually get done. And having analytics which identifies problems can help bring the most important problems to the top. But those middle problems, they're not a clear priority. They don't You're identifying problems, but it doesn't it's not screaming that it needs to be worked, right? The problem with analytics is it just brings more work and it doesn't necessarily help take the work away. That's where
Right.
automation can come in. And with what we're seeing, with agentic AI and being able to, and you have to be able to manage this stuff, but with what we're seeing, and it's improving by the month. It is just so well, practically by the day, or sometimes it feels like by the hour. The ability to the ability to manage these tools to actually bring automation to the forefront is just growing by leaps and bounds. And the if we can bring that into the healthcare back office teams, I think we can begin to make use of the analytics to identify the things that need to be done and send off agents to go out and get these things done, rather than just telling an already overworked team what else they need to do.
Right. So instead of presenting me a problem, you're presenting me a problem with a solution, and you'll go do it.
Bringing a solution. That is without a doubt the most exciting thing I see for infusion and for healthcare in general.
Yeah, most definitely. And then if you had just one last piece of advice for infusion center owners and operators, what would it be?
Automate the boring parts. That's where all your risk lives. That's where all your problems are being created.
Mm.
Just because they're boring doesn't mean that they aren't big. And mostly whenever they're boring, they're pretty easily fixable. So do that when you can.
Okay. Well, Aaron, thank you for your time, for all of your wisdom, and for sharing all of your experience with the We Infuse listeners.
Awesome. Well, thank you for talking to us, and you have a great day. Thanks, Amanda.
Well, that was great information from Aaron Smith about how Vetriq doesn't replace RCM systems, banks, or lockboxes, but rather connects them so that the work between them disappears for your team. And loved his origin story with FlexCare and his history with We Infuse. If you're not already familiar with the We Infuse software platform and RX Toolkit's web-based resources, I encourage you to schedule a test drive. These tools can save you time and money in your practice while making infusion safer for patients and caregivers. My name is Amanda Brummett, and we'll catch you in the next episode.